Local Optical Committee. I'm also a council member for the College of Optometrists, so I represent the West Midlands. I'm a self-employed optometrist. I work in a small independent practice. I'm part of the Eye Care Advisory Board in Scotland, and many of you may have remembered me from the conference that we had. I was talking about Optom Academy, so I run pre-registration courses for optometrists, and we also offer CET training as well. I'm a WOPIC examiner, part of self-consultancy with Michelle, and I was finalist optometrist the year 2018. So just introduce Michelle.
Hi everyone. Yes, my name is Michelle Dias and I'm a public health specialist. I have a few roles at the moment. So I'm a Healthy Living Pharmacy lead. So I've been supporting the Healthy Living Pharmacy initiative since 2012. I'm also a community pharmacy development officer, so developing services in community pharmacy. I'm a director of Central Health Solutions, which is a provider company across the West Midlands. Also director of my own company, which is self-consultancy, which we both work for. And I was recently winner of Royal Society for Public Health Excellence in Learner Support for the work that we have done around healthy living optical practices.
Okay, so just to give you a bit of background, when I was at university, my dissertation focused mainly on macular degeneration, smoking and AMD. So I became very passionate at that moment in time about prevention and eye disease. So when I became chair of Dudley Local Optical Committee, I decided to write a letter to public health saying that maybe we should have a concept around smoking and blindness, have a poster campaign. My letters were acknowledged for many years. So I kept writing every year, but nothing actually happened. And then one day I happened to have a meeting with the Director of Public Health, in a meeting where optometry wasn't discussed, but I was told by the LOC that you should be attending these meetings. And I said to her, I've been writing to you for many years, but nothing's actually happened. And then she said, you know what, let's have a meeting, get together. So she got together with her team, Michelle was part of that team, and they thought of an idea where they were like, maybe we could have more than just a smoking campaign. Why don't we do something like the Healthy Living Pharmacies, but do Healthy Living Optical Practices? So they came back with me in terms of service specifications and saying, maybe we could do NHS health checks, smoking, weight management, alcohol screening, and they also came back with chlamydia screening, but I was like, that's not going to work in optical practice. Okay. So we got rid of that, but the other 4 services I was like, this can definitely work. So if we have a look, oh sorry, that's the title, by the way, public health services, can you see them being delivered? Yes, hopefully, Healthy Living Optical Practices. So if you have a look at the slide there, we actually got Healthy Living Optical Practices sorted out within 9 to 10 months from the moment when there was a launch event. So we organized a launch event, invited many practices, and it's literally like throwing a party and seeing who turns up. And the good thing is everyone turned up because they hadn't heard of having public health services being delivered in optical practices. And then we had the practices become Healthy Living Optical Practices, and then commission services. Okay, now the thing is, we did everything in one go, and that was probably not a good thing because that meant a lot of time out for optical assistants. They had to attend training for weight management and smoking cessation, and these are day train, like, you know, many days. And then trying to do the leadership training and the health champion training, which Michelle's going to talk about in a bit, was just too much to do in one time. So that's probably something that we would not suggest. I think it's becoming a Healthy Living Optical Practice first, becoming accredited, having the logo, and then having commission services. And the thing is, with commission services, it's different services in different areas. So for instance, in Hull, there's like an alcohol smoking problem, isn't there? So you'd probably be thinking having a service around that, but in Devon it might be more to do with loneliness maybe, or mental health, so different services will be commissioned in that area. So it all depends on which area you're from, what kind of services will be commissioned.
Okay, so really exciting in Dudley. Each time a practice was accredited as Healthy Living Optical Practice, we had a grand launch event. So we invited, to the first one, we invited the Mayor of Dudley, who came along, and also our Director of Public Health, and we had a big launch event, invited the press along to that too. We had optical practices that put buffets together. They showed their certificates, they showed their accreditation to members of the public, and they talked to members of the public about what it meant to be a healthy living optical practice. The photo in the middle of that slide shows all the certificates that the optical practice staff achieved throughout their journey of becoming a healthy living optical practice. So they had that wall in their practice showing all of their achievements to date for HLOP.
There we go. Right.
Okay, so we have our first poll of the evening. So we know that the NHS is facing huge cost pressures at the moment, and optical practice can support some of that and support the agenda. So I just wanted to know what you believe the cost is to the NHS each year due to unhealthy lifestyles, so smoking, inactivity, alcohol, etc. So does it cost the NHS 14 billion a year, which is A, 14 million a year, which is B, 4 million a year, which is C, or 4 billion a year, which is D? You can vote now. Like who wants to be a millionaire?
I know, it is, yeah. It'd be interesting to see how many people get the answer right on this. I didn't know this before, did I?
Do we have an answer?
Ooh,
oh, okay, excellent. You actually got that correct. Most people got that correct. So it is A, 14 billion. So that's the cost to the NHS through unhealthy lifestyles. But there's actually more costs than just to the NHS. So, for example, productivity costs the UK economy about 73 billion each year. So that's people not being able to go to work and things like that due to conditions that are caused by unhealthy lifestyles. So that infographic was put together by the King's Fund, and that shows the cost of inactivity to be 1.1 billion a year, obesity to be 4.2 billion a year, people drinking more alcohol than is recommended costs the NHS 3.5 billion a year, and smoking is still the biggest cost to the NHS, and also the number one intervention you can make to improve your health, and that's 5.2 billion a year that is spent on conditions that can be caused by smoking. So 14 billion in total.
That's a lot. That is a lot, and a lot of potential, I think, for us to be
have an impact
in
that. Yeah. So just last Monday, the Health Secretary Matt Hancock set out his long-term vision, and he did put a focus on prevention. So at the moment in this country, we're spending about £97 billion a year public money on treating disease. Yet we're only spending 8 billion on preventing disease, which to me is shocking. So 10%, 10 times more money is spent on treating disease than actually preventing disease. So Matt Hancock has set out and is putting together some plans for a green paper which will be released next year to set out the vision on what we can do to achieve all that. And shocking, I'm a public health specialist, but it still shocks me that this country, the UK, is amongst one of the worst in the country, in the world rather, for life expectancy. We're still having people that are dying prematurely from health style related conditions.
Okay, so can optical practices support the national agenda, which is all about prevention? I think definitely yes. Having looked at the results from the scheme, I say yes, because, for instance, I mean, Michelle's going to go through the details, but 316 people in 1 year had been picked up just through 8 practices as having NHS health checks that had not been had NHS health checks done with their GP or pharmacy. So NHS health checks are done normally between the ages of 40 and 74 every 5 years. So we are tapping into these patients. So why is it that optical practices are going to be successful in this? Well, the thing is, we're seeing patients that may not access other healthcare providers. So how many times have you had a patient that's come to you who's 60, I've never had my eyes tested, and then you're like, how's your general health, blood pressure? Oh, I've never been to the GP, everything's fine. And you're thinking, hold on, he's at high risk, he has not had any blood tests done. And the thing is that we're already picking up early warning signs. So how many, I'm sure every single one of you have picked up patients who've got undiagnosed diabetes, blood pressure, or had a stroke, or a risk of a stroke, or having high cholesterol as well. The thing is, we do spend longer with a patient than any other primary care practitioner. So if you look at patients who are seeing their GP, normally they're given 7 minutes. And if you had 2 problems, why didn't you book 2 appointment slots? Whereas if you look at the pharmacist, patients are normally just rushing in. They need to hurry up, grab their medication. I've got to go and do the school run. And they don't take out time. But you know, when they come to an optical practice, they have taken out time at least an hour and a half. So if you think somebody's at risk, say, of it, and they should have an NHS health check done, the risk of cardiovascular disease, then you would say, come outside, my optical system can do it right now. There's less chance of loss in transitions, because when you say go and see somebody else, there's a chance that they won't go. Whereas if you've got somebody who does it on the premises, you know, they're more likely to take up the offer. And just one thing we have to remember is that patients come into an optical practice because normally after 40 they become presbyopic, they need reading glasses, and that's what drags them into it. So potentially we're picking up people that wouldn't have been seen by the GP or pharmacist. The other thing is that staff really do enjoy providing the services. So the optical assistants have loved it. They feel that they're more valued. There's you know, they've got diversity in terms of their career. They're not just focusing on glasses. They feel more important, that, you know, I've had all this training and I can now help this person in terms of, you know, alcohol, talking about alcohol, or the fact that I can do an NHS health check just like the nurse would. And I just genuinely think that optical practice is an untapped resource. I think because of this, we are now on the radar. So if you look at public health, they're now looking at not just GP pharmacists, but they started thinking optical practice as well. And I think it's about time we were valued in terms of clinically where we are, rather than just seeing us selling glasses. So this is my clinical side now, Optimal Academy side coming out. I had this patient that came in actually as a walk-in. I clearly remember the day when he came in, and he said that every time I get stressed, I go blind. And then when I calm down, my vision comes back again. Okay, so this is what I saw when looking at the fundus. Okay, so now if you can use your poll again and do your voting. I'd like you to tell me what you think this condition is. Okay, so is it optic neuritis? Is it bilateral vein occlusion, papilledema, or planet Mars, as most patients
Planet Mars,
say?
isn't it?
Most patients would say that looks like planet Mars to me. Okay, so if you could just vote.
What do we think? 60%.
I think everyone should get it right.
Even I know now. It's tense.
Shamina, can you hear me?
Yeah.
Can you see the poll at the moment?
I can't see the results, only the poll.
No, I'm still there for answering, but nobody has answered yet. So
okay.
I'm not sure whether that's because they're thinking or because they're not choosing. Here we go. They're starting to vote now.
Okay. So just remember, when he gets stressed, he loses his sight. And then when he calms down, the vision comes back again.
Is that a clue?
It is a clue. It's a massive
That's
clue.
fine.
Okay, the answers are coming in now, but still only 50% of our attendees. So we'll leave it a few more seconds.
Okay. Come on, guys.
I
need you to vote quickly.
Okay, I'll end the polling there.
Oh, well done.
Oh, I did put in a trick question, didn't I? Okay, so most people here have said papilledema, 75%. 25% have said optic neuritis. Okay, so I can see why people may have said optic neuritis, because, for instance, in optic neuritis, you find that it's usually made worse by heat. So if you've got problems in terms of the heat affects the nerves, and the nerves get affected and you get optic neuritis, but it's not actually that. It was actually papilledema. So it's grade 4 papilledema. The vision actually, if you look at the right fundus picture, his vision was 6/24, and the left one was actually 6/6 still, and that's because it wasn't as swollen. But if you look at the right picture, it's completely swollen. Okay, now what do you think, this is the second part of the polling now, what do you think has caused it? Now that we know it's papilledema, what do you think's caused it? So is it A, tumour that's causing it, B, malignant hypertension, C, idiopathic raised intracranial pressure, or D, is it diabetes? So what do you think has caused this papilla edema in this patient. So again, going back to he gets stressed, the vision goes, he calms down, the vision comes back. So what do you think might be causing it?
Vote now. I could be an optometrist now.
Yeah, you could.
I know the answers.
Oh, this is interesting. Okay, so 67% of people who are listening in today have said idiopathic raised intracranial pressure, and 33% have said malignant hypertension. No one said tumor, no one said diabetes. Okay, so if somebody is getting stressed, it normally signifies that their blood pressure is increasing, and that blood pressure is what's causing the intracranial pressure to increase, which means then they get papilla edema. Okay, idiopathic raised intracranial pressure is when there's no cause for it. Okay, and if I just go back, I'm going to go back to the fundus pictures just to show you that there is signs of hypertensive damage. So you can see the cotton wool spots, you can see the exudates, and you can see there's few hemorrhages. So you know there's hypertensive retinopathy here, but you also have got grade 4 malignant hypertension, which is the main reason why this has happened. Okay, now just to give you a bit of brief background in terms of what happened with this patient, I sent him, he was an area manager who's very busy, hasn't got time for anything, and I said to him that you need to go straight to A&E right now, and his obvious answer was, I haven't got time because I'm really busy. It's only when I said that I'll take you myself that he took me seriously, and went straight to A&E. And then the consultant phoned me up 3 days later and said, you know, thank you so much for sending him there and then, because if you hadn't, he'd be dead by now. And that is because he had damage to his kidneys, because of the blood pressure being 240 over 140. Okay, so gosh, Michelle, what is normal blood pressure?
Around about 140 over 80 would be okay.
Yeah.
So yeah, that's very, very high pressure.
Yeah. And then when it's about 180, it's called essential hypertension, and malignant hypertension is when you're hitting the 240 mark. Okay, now when I was at university in my third year clinics, I was told that you're not going to see patients with malignant hypertension causing papilla edema in the West. You'll see it in third world countries because there's a lot of patients that are undiagnosed, but you won't see it here. However, I've seen 8 cases in working as an optometrist for 12 years now of patients having papilla edema because of malignant hypertension. So it's not as uncommon as you think. And what we need to do is we need to get these patients before they get to this stage. So that gentleman obviously hasn't been picked up as having high blood pressure. He's not just been to see his GP, but a lot of people sometimes will present to you because they're having sight problems, and so you need to look at the disc carefully, and obviously refer the patient if you think that they may have high blood pressure. But like how optical practice is, you have the blood pressure machine there, so you'll be able to do it there and then.
Okay, so back to what Healthy Living Optical Practice is. So we developed our framework from the Healthy Living Pharmacy scheme. So each practice has a leader, which is normally the optometrist or practice manager. So they undergo training to become a more efficient leader. We then have the frontline staff, so your optical practice staff that are trained up to become health champions. So they undergo a qualification in Royal Society for Public Health, which is a level 2 understanding health improvement qualification. So both aspects of those training are full days training, and the health champion training has an assessment at the end that the health champion needs to pass in order for them to have the title health champion. So we provided those elements of training to our optical practice. We also then talked about what the local health needs were. And this is where Shamina said at the beginning, it's really important to know what your local health needs are, because they do differ in different geographies across the country. So look at what your health needs are, what is your population, what are the demographics of your population. We then encouraged optical practices to have a health promotion zone. So completely alien in optical practice was identifying a place in the practice that they could promote health messages. So dedicating an area in practice where patients that walk in can see that there are messages around health. So each campaign is promoting one topic, so there's not lots of different messages on there around alcohol, smoking, etc. It would promote one particular topic, and then that would be changed, for example, at least every 2 months. So we've had, we'll show you some examples of some health promotion zones, but they will promote safe messages and messages around health and wellbeing. And actually those health promotion zones have been key to this initiative, because it's quite difficult in an optical practice for you to have a conversation with somebody around weight or alcohol. Somebody's coming in for a pair of glasses and you say, oh, how much alcohol do you drink? It's kind of a bit of an obscure question to ask. But actually by having this health promotion zone, they can see that you are promoting safe messages and health and wellbeing messages. So straight away that they know that you're talking to everybody that comes in the practice, not just because you may think that individuals walked out the pub or need to lose a few pounds. So they can see that you're promoting health and wellbeing messages.
Just to add, at the moment in Dudley, we're having a flu jab campaign at the moment. So we try and line up with the pharmacists and what's happening nationally. But at the moment, Public Health in Dudley have just sent out loads of information to all the Healthy Living Optical Practices saying, can you, because you have patients who are diabetic, who've got chronic conditions, can you have a chat with them? Can you just give them a leaflet on the flu jab? So that's something that's working at the moment in Dublin.
So that's a national campaign that optical practices are now tapping into. And then this is all around level 1. So optical practices, once they achieve all this criteria, become a level 1 healthy living optical practice. And then we look at commission services. So as Shamina said at the beginning, in Dudley, we have learned that actually trying to get optical practice to do everything in one go doesn't work. And it bombards them with too much information and too much training in one go. But once they've got the fundamentals right and they've got all those things in place, then we can look at whether commission services would work in that area. Are there services that are commissioned? What's the particular health need? And how you can support public health commissioners to encourage people to have healthier lifestyles. So that's what our framework looks like. So as I said, level 1 is about being proactive, about raising questions around giving brief advice to patients that want to make a lifestyle change, and then signposting to services. So again, a key part of being a healthy living optical practice is that you're aware of local services that you can signpost patients into, because if you do identify a smoker that wants to quit, you need to know then where you can signpost that patient for that support to be able to quit smoking.
And then once you become a healthy living optical practice, you're giving that information. So your local public health would say, here's a folder, here's all the information, so you know exactly where to send the patient to.
Yeah, so find out what services are available in your area. And then, like I say, moving on to level 2 then is where you can start looking at what services may work or what are needed in your particular area.
Okay, so just so you know the background, Healthy Living Optical Practices were originally when we first did it, it was called Healthy Living Opticians, but we've had to change the name to Healthy Living Optical Practices because somebody had pointed out that actually not all practices are opticians. So in order to be an optician, the contract holder needs to be 50% of it needs to be a professional that's owning the practice. And we know that there's a lot of practices out there where the contractor is not necessarily an optometrist or a DO. And so we wanted to make sure that all practices were inclusive of this. And so for that reason, we decided to then rename it to Healthy Living Optical Practice. So it's not actually called Healthy Living Opticians any longer. So it's taken me about 3 years now, I think. 3.5 years. And I realized, because I saw the potential in Dudley, and also there were a few concerns within Dudley as well, I had to make sure that insurance-wise everything was valid. So I contacted the AOP and FODO and gave them all the contracts. And the good news is that AOP and FODO are now covering any activity that's covered in a Healthy Living Optical Practice. So the worst case scenario is you're doing an NHS health check and somebody walks past, they trip over, bleed, and that blood contaminates when you're doing somebody else's finger prick test and there's some kind of condition that's been transmitted across. I was just thinking of the worst case scenario, and that's all covered. Okay, and also any conversations that you might have and somebody might be like, you gave the wrong advice or whatever, it's all covered now under both FODO and AOP. We've been everywhere, to be honest. I don't know how many people here have read about the Healthy Living Optical Practice in Dudley, but OT have done many. The first year of success there, the results were published, and we've also been part of the local government association. They've done a booklet that was partnered with LOXU and Optical Confederation. They've spoken about healthy living optical practices, as well as MECs and other services, community services. It's not in line with that. And then Michelle, you've done a blog, haven't you, as well, for the RSPH?
Yeah, so RSPH are really interested in this, interested in expanding to other areas across the country. So they invited me to have a guest blog on their website talking about the what had happened in Dudley, and also the fact that we are now working across Derbyshire and Nottinghamshire to roll out healthy living optical practices. So lots of press.
Yeah, good.
These are the health promotion zones. So like I mentioned earlier, so a health promotion zone is there to promote health messages to people that walk into your practice. So we have one on alcohol there. Like I say, really difficult to bring up conversations around alcohol to somebody that's walking in for a sight test. But actually by having bottles and cans of alcoholic drinks labelled up, so labelled up with the unit information so people know how much units are in different drinks. We've also had optical practices that put the calories on there, because some people are more interested in calories than they are in units. So putting the units and calories on cans and bottles and displaying those in the optical practice raises questions, gets people thinking about how much they're drinking, and removes those barriers to having those conversations. It does mean that you do have to drink the alcohol at home to bring the empty bottles in, but causes for causes, and at least you'll have a lovely display to show your patients that walk in. We've had lots of health promotion zones around smoking as well, which is a really key one, because of the links with smoking and eye health as well. That's been we actually devised our own campaign around smoking and sight loss, and showing patients the link actually between smoking and sight loss, which a lot of patients are unaware of.
Yeah, I think the only thing I was going to touch on with the alcohol is that the reason why it was a success in Dudley is because it's a scratch card that they use. So you just literally, there's no patient identifiable data, and you just say, look, there's a screening. Have you ever had an alcohol screening done? And they usually say, no, we haven't. And then using the scratch card, they can identify if they're at high risk or not, and then you give them brief intervention. And this is the service that people were most reluctant to do. Yeah, they were most reluctant about this, but actually this service has done the best out of all of them. And I think it's just because they just say, Dudley Public Health are doing a pilot at the moment in terms of alcohol consumption, do you mind participating? And during the pre-screening, they're like happy to do it, and then they're actually quite interested to see how much am I drinking, am I over the limit or not. So I think they find it really useful in that sense. But yeah, there's been about, I mean, Michelle's going to go through about 12,500 alcohol screening just in the first year of this in operation.
Okay, so yeah, that moves swiftly on to some of the data with our level 2 healthy living optical practices. So you can see there, in just about a year and a half, we had 36 people that were recruited to the smoking service, and 15 of those went on to achieve a quit. Now, you may think that that's quite low numbers, 15, but those are 15 patients that would not or may not have accessed a smoking cessation service anywhere else by any other provider. And the optical practice staff found that such a reward, so rewarding to actually support an individual to make that change and quit smoking. And actually those 15 individuals now may not go on to develop cardiovascular problems or other problems due to smoking. As Shamina mentioned, over 12,000 alcohol interventions, and what was really key to that was actually about 12% of those people that were asked about their drinking habits were identified as being harmful drinkers, so drinking more than the recommended weekly amounts. So those patients were then given some brief advice and support, and we actually referred one person into specialist services. Again, that person may not have had that advice and may not have been referred into specialist services if they hadn't had that service in the optical practice. And 316 health checks were achieved in just over a year. So again, 316 health checks that may not have happened anywhere else. And actually those health checks did identify people that had hypertension, that were diabetic or pre-diabetic, that may not have been picked up elsewhere, and actually then an intervention was made, or they were referred back to their GP for further support.
And just on that note, I will just say that when the GPs found out that we were doing NHS health checks, there were a few concerns about the fact that we're taking their business off them. But Public Health made it quite clear that we've picked up people that they wouldn't have otherwise. It's as simple as that. We haven't taken business from you. We're picking up people that you're missing. So there's no reluctance now in the sense that they understand that. And I think anywhere else, if this happens nationally, GPs will understand that we're picking up people, and then we're obviously referring them onto them eventually anyway if they're at risk of cardiovascular disease.
You can find out how many health checks are provided in your area. So if you think that your area is actually underachieving with health checks, you can find that information out, and then why not approach your commissioners to say, well, we know that we're not achieving the amount of health checks that we should be in this area. Can we support you? Can we start providing health checks?
Yeah. So why can optical practices provide commission services? We've just spoken about smoking, biggest risk factor for the most common cause of blindness in the UK, AMD. And a UK survey assessing the awareness among the general public found that fear of blindness would influence 69% of current smokers to change their smoking habits. So they would probably reduce it or they'd quit. Okay, and I know that from personal experience. When I say, did you know smoking can cause the most common cause of blindness in the UK? Like, I never knew that, and it could be just the last thing that they wanted to hear that would just say, right, I'm gonna quit. And actually, talking about that, this packaging here, Michelle actually saw this, didn't you?
Yeah, so I was out one evening drinking my recommended units of alcohol, no more obviously, and noticed that somebody had come in from the smoking area and put their packet of cigarettes down. For the first time ever, I saw this warning on the cigarette packet around eye health. So I did actually ask if I could take a photo of a cigarette packet, which is strange things I do when I'm out on a night out.
We did go to the public health conference, and there I did put my hand up in front of everybody saying that there's nothing on cigarette packets talking about smoking and blindness. And then literally, 6 months later, we see this. So maybe something,
I still think there needs to be more awareness.
Definitely. I think TV advertisements more than anything.
Yeah, but that's definitely something you can highlight in your practices.
There is little correlation between eye disease and alcohol consumption. Okay, so there's been a few studies done, but nothing concrete. The only thing we do know of is toxic amblyopia. Okay, so there's no association really between eye disease and alcohol consumption. And then with regards to NHS health checks, obviously we're spotting early signs of stroke, heart disease, diabetes, kidney disease, and even dementia as well. Okay, so these are the things that I think have worked well in Dudley and can definitely work well in other areas. But going forward, I think slips and trips, mental health, dementia, why not?
A whole range of services that can be provided in our optical practice.
So we're coming to the end now, but just in terms of what our vision is, the scheme, we believe that it needs to be recognised, and I think it needs to be rolled out nationally. It's worked in Dudley. I don't see why it can't work across the whole of West Midlands and why not across the UK. If we picked up 316 NHS health checks in 8 practices in a population of 300,000, imagine if that was rolled out in West Midlands. Imagine if that was rolled out across the UK. So I think it's just something that is just a matter of time, but people need to make it happen. We can't do it. You guys need to do it. So this is where maybe you can approach your LLCs and say, can you approach public health and use the results of the Dudley scheme to say, why not in our area? Try and get funding, try and get practices accredited as a healthy living optical practice. But if you talk more about that, I think.
Yeah. So getting to level 1, like I say, is around upskilling the staff, having the premises fit, and then thinking about what you can offer in optical practice. But we've discussed other services that would work really well in an optical practice, such as dementia screening, such as mental health, such as falls. Obviously, there's a correlation there between eye health and falling. Why not have a fall service where you're supporting patients that could be at risk of falling? Again, that's a massive cost pressure on the NHS for people that fall. And I'm probably going to get shot down for this, but also, why can an optical practice, an optometrist, offer flu vaccination?
The GPs would go on strike. The GPs would go on strike if they heard we were doing flu jabs.
But why not? Again, you're seeing patients that may not access any other healthcare service. Why can you not offer that and increase the amount of flu vaccinations they give each year?
Okay, so just to wrap up, I'm just going to, if you have a look at that picture there, this is a picture that was taken from a hotel room about 2.5 months ago. So I went on my pilgrimage, which is Hajj, which is where you have about 5 million Muslims that come together in Saudi Arabia. And it involves 6 days of the pilgrimage, which is in the desert in August, which is about 47 degrees, wow. a lot of walking, and you have to be on your best behavior because this is God's house, so you need to be well behaved when you're interacting with other pilgrims. But if someone had said to me 5 years ago that I would have been going on my pilgrimage this year and that nothing would have happened, I would have been perfectly fine and I would have coped through sleeping in the desert under the stars amongst 5 million people at 47 degrees heat, I would have thought, no way, that's not going to happen. But I think when I was there, I happened to meet somebody who was from Indonesia, and he'd been trying for 11 years to come on the pilgrimage. They have like a lottery system where if your name comes out, then you get a chance to come on the pilgrimage. And then somebody else from India who just sold his farm and everything just to come here. First time he sat on the plane to come here just to do this, got nothing to go back to. And then I thought, you know, I'm really lucky that I'm here, that I've had this opportunity to come. And then I think it's after that, my mindset just completely changed. I was really panicking, and then I changed, and then I got through it, and I thought, I'm so lucky I can do this. So I think if you, from this experience that I've had, if you then think about healthy living optical practices or anything in your life which is different and you think you can't do it, you know, if you've got a positive mindset, you can do it. If you're confident about the scheme, you can then sell it to all the optical assistants in your practice and say, well, I can see this happening. And I think this is probably what's going to make healthy living optical practices successful. If you are thinking positively and confident in selling that idea to your staff and your team. And then on that note, we would like to now know, now that you've listened to us today, is could you see your practice becoming a healthy living optical practice? Okay, so A, yes, B, no, C, maybe, or D, never in a million years. So if you could just vote now. If someone says never in a million years, I'm not going to be happy. Okay, excellent. We're happy.
No no's.
And no, never in a million years. Thank God for that. So 71% have said yes, and 29% have said maybe. Okay, so that's good. That's encouraging, and that's what we're getting. Whenever we go around to different places, we talk about healthy living optical practices. Everyone's very passionate about it. But the only people who can make this happen are you guys. So you need to go and talk to your LOCs and talk to public health. It was me persisting with public health that this ended up happening. So it's you guys need to make this happen.
And actually, the schemes continue to flourish in Dudley. It was a pilot. It's not a pilot any longer. Practices are continue. They're expanding to more practices. So a third of practices in Dudley are now healthy living optical practices. If you do need any more convincing, we have written a report, which is on our website. So there's a link to it there. So that's a report of the pilot, which has got some of that data in that we shared with you earlier, and also some wording, some ideas from other from patients and also from healthy living optical practices, so what their experiences were of the whole process. We've also got a video link on there of an interview with a healthy living optical practice, so for the practice manager and also for the health champion, and again you can see that their thoughts and their experience of the whole journey. Those are our contact details.
Yeah, so I think this webinar is going to be available on the website, so you'll be able to get all the information that you need. But if you need to contact us to get any more information, we're happy for you to do that.
And we're happy to support your area. So if you are in an area that think this could work, you know, we're happy to work with you and work with public health commissioners. I was a public health commissioner. I'm happy to talk to other public health commissioners to show the evaluation and to actually, you know, show that actually this could work across the whole country.
Before we go on to questions from you guys, or while you're typing, we've had a question from Sonal Rugani. So she obviously heard about this and she's got some questions that she sent in advance. But so she's saying that as optometrists engage with public health initiatives, how should optometry practices engage with other health professionals and public health services on a local level?
Okay, like Shamina said, that could be done through your LOCs, but find out who your commissioners are, and yes, it may not just be public health commissioners. Find out about your CCG, find out about other providers of services in your area. It could be charitable organisations. Find out what's happening, what are the health priorities and what are the needs in your area, and contact them either through the LOC or directly. Contact your commissioners, they will talk to you.
And then the other question that Sonal's, by the way, she's an independent public health optometrist, so she's obviously very passionate about this. But she's asking that as optometry practices engage with public health initiatives, what data can be collated from IT systems and what data can optometrists themselves generate in terms of the clinical assessment that is of value to public health?
Okay, big question. Okay, so we have collected data, and you'll see that in our report. So yes, absolutely, data can be collected from IT systems, and there are various IT systems out there that can collect that information. The one that we used in Dudley did actually send messages back to the GP practice, so through a secure link, so GPs are aware of what services are being offered in optical practice. And it's really important actually that information is gathered, so information on those services. So what difference has it made being a healthy living optical practice? How many people have you had conversations with? How many people have been referred into services? How many people have quit smoking through the service that you provide in your optical practice? And then that is then showing to public health actually your value, and that's why it worked in Dudley, because we did collect that data, and that's why it's carrying on in Dudley, because the commissioners in Dudley have seen that actually optical practices are making a difference with the population of Dudley.
Yeah, and on that note, I think we've actually done better than pharmacists, haven't we?
I can't say that.
But we have.
In some services, yes.
In some services, we have done better than pharmacists. And think about it, pharmacists have been doing it for a lot longer. It started in 2008 in Portsmouth, and then it grew, and then obviously this has started in Dudley, and hopefully it's going to grow as well. But for the reasons I've already outlined, that's the reason why we've done so well and we've been so successful in Dudley with optical practices. But yeah, we're definitely on the radar in terms of, especially when they looked at the figures. But I think the IT system, just how you got with MEX, you have the governance, you have your monitoring figures. It's the same thing. We use the same kind of IT platform to be able to collect the data and look at every episode and what's actually happened from that as well. And we look at the results every 3 months. Okay, so we're just waiting to see if there's any questions that
Hey, Shamina, I'm not sure if you've got your chat function open, but if you go down to the icon, I think is at the bottom of your screen or top, but Robert from Thomas Carter Opticians has asked, do you see that one, Shamina?
I can see it, yes.
Yes, would you like to read it out?
Yeah, so for level 1, are there any, this is from Robert Thomas, okay? For level 1, are there any funding streams? What is the minimum number of practices for NHS to be interested? So for level 1, in terms of funding, I would say, Health Education England is probably one avenue to go down. So if you have your local eye health professional network chair, get in contact with them and just say that, look, this has happened in Dudley, here's a pilot, here's a report. Can you possibly look at getting some money for training of healthy living optical practices? So what they pay for is the leadership training and the health champion training, and then the material in terms of the logos and having a signposting pack so that you can send them to a smoking cessation service that's in operation. So once you're accredited as a healthy living optical practice, it's then easier to get commission services, and that's when you would then work on that. But to become a healthy living optical practice, initially you just need to have somebody who will pay for it. I'm unsure whether LOCs would be able to fund that. So with us, it was public health that funded that. Local authority had the money, they had the budget to do it, but why not approach them and also think about Health Education England as well? So in terms of the number of practices,
well, you only actually need one practice to make a difference.
Yeah.
So if there's one practice in an area that wants to become a healthy living optical practice, then why not go for it? Talk to the LOC, talk to your commissioners. You could fund it yourself if you're really passionate about it. So there is training out there and support to become a healthy living optical practice. You could fund it yourself. You could then show that to commissioners to say, well, look, we've achieved all this. Are doing what other healthy living optical practices are. And we talk to you about the possibility of commission services.
Yeah.
So one will make a difference.
Yeah, I mean, in Derby, Nottingham, we've had quite a few practices that have been interested. So I wouldn't underestimate that, just because, in Dudley we had a lot of practices. And the other thing I was just going to point out is that we have had a range of optical practices interested. So you've got multiples and independents, okay? But if you compare the different types, I'd say when it comes to core multiples, we've had more problems engaging with them because they've got a head office that need to approve everything. But franchises we've had no issues with, and independent practices we have no issues with, because they're the ones who are in charge of what's going on in their practice. So we've done better in that sense. Has anyone got any more questions at all? If you have, then please send them across.
While we're waiting, Shamina, obviously what I've gathered from your excellent talk this evening is that independent opticians can be really what one might call health champions within the community, can't they?
Yes.
It's that ability not only to be providing some of those additional services, but also to be able to signpost them to other healthcare providers and services in the community. So there's a double provision there that's being done.
Yeah,
That's my observation. But also the question I'd like to ask is, do you think there'd be any value in the patients within a practice to be supporting the lobbying or the accessing of funding or speaking to their MPs, etc., to try and generate that support? Is that something that might be useful or not?
Well, I think firstly, the professionals need to get in touch with the public health and let them know about this and talk on the money aspect, the prevention aspect, and the clinical aspect. And then if you feel that if you got patients together and said, look, we've noticed that there's these issues in this area and the public would benefit and we as optical practices can provide this, then I don't see why not. What would you say, Michelle?
And actually going back to patients, we've collected case studies from patients that have shown to us and to commissioners that actually they wouldn't have made that intervention if they hadn't had that conversation in the optical practice. So actually patients can really champion the cause. We did also invite an MP along to one of the launches, so MPs are very interested in optical practices offering more than sight tests and looking after the health and well-being of individuals. So definitely lobby your MPs and counsellors. And yes, patients have probably got the biggest voice of all. So if your patients accept these services and accept this advice given in an optical practice, then you're onto a winner.
And in terms of the report that we did, the pilot, 86% of people in our report said that they were very happy receiving a public health service, and 90% said they'd happily recommend that their friends or family to come and have a public health service delivered in an optical practice. So again, if you look at our evaluation report, everything's in detail there. So patients are loving it. Optical assistants are loving it, and obviously if you have commission services, there's a chance for you to generate money, and if we look at in terms of money, it's different in different areas how much public health will pay them. But in Dudley, for an NHS health check, we were getting paid £20 and the consumables were provided by public health as well, and that's good for an optical assistant that's doing it, not an optometrist.
What we have found as well is if patients have received a service in an optical practice, that actually they've told their friends or family members about it, and the family members have come in actually for that public health service rather than a sight test. But then on the back of that, well, when was the last time you had a sight test? That they were then obviously given some support and given an appointment for a sight test as well. So, and that engagement that you have with the other services and signposting and knowing what's available in your local area is not only for you to signpost into those other services, but actually for those other services to know what optical practices offer and to talk to people about eye health. And actually, if they're providing their particular service or they talk to a certain group of people, they may bring up the fact that actually, have you had an eye check recently? Why don't you go to an optometrist? So actually it works both ways, and making sure that other services know about what you offer.
But if you do have any more questions, you've got our details, so feel free to email us. But just so you know, I'm getting phone calls literally every other week from some public health specialist or some LOC around the UK who've heard about this and they're interested in this. And you will find that lots of public health, they might have pockets of money where they might be able to fund a bit of training for healthy living optical practices. So I think it's a matter of LOCs and optometrists engaging with them and saying, have you heard about this? And have you got any funding at all to try and get this accredited? I think once there's healthy living optical practices across the whole of the UK, then they can look at commission services. So that's what we kind of envisage, really. But yeah, do feel free to get in touch with us if you have any questions that you think about afterwards.
Lovely. Well, it's been an extremely interesting webinar this evening. I think our attendees are being a little bit shy with the questions this evening, so we won't. I think that's really because you've been so informative, ladies. You've given so much information, and we could not have asked for more. I'd be really interested in maybe talking to you about perhaps doing a follow-up webinar at some point, just to sort of maybe go into some aspects of the Healthy Living Optical Practice in a little bit more detail. And perhaps those of you attending this evening might want to give me a shout or by email to let me know if you would like that as well. I'll also go onto our forum and try to get more members who perhaps couldn't make it this evening to watch the webinar on the website and give their feedback as well.
John, the only thing I wanted to just add is that if any of the members want any particular topics covered in terms of Optom Academy and clinical information, then please just get in touch with John, because I'm going to be probably doing another webinar, but I was thinking of going through interesting patient case studies or maybe flashes and floaters. But if you can get in touch with John and he can let me know what subject you may want me to cover.
That would be absolutely wonderful, Shamina, and thank you very much for the kind offer. Well, with no further ado, I'd like to give my sincere thanks to both Shamina and Michelle for giving their time this evening to talk about a most interesting subject. I'm sure you'll all be giving some serious thought to this, because independent practices have got to look at every opportunity, not only to provide greater healthcare for the community, but also to look at their own business success. So making the practice work even more for them has got to be a positive outlook for the independent practice. Our next webinar is going to be on the 6th of December, so please look out for information about that, which will be coming out shortly. And do look out for perhaps our follow-up webinar from Shamina and Michelle, which I certainly will be looking forward to. Thank you once again, Shamina. Thank you, Michelle. And I wish everybody a very pleasant evening. Good night. Thank you.
Bye.
Good night.